What's going on, guys? Tony Maritato here, licensed physical therapist. And in this video, I want to talk about a condition known as patellofemoral pain or a patellar tendonitis or a patellar tendinopathy. Basically pain at the front lower portion of the knee. So somebody had posted a question about pain while they were going downstairs. If they walked downstairs foot over foot, what they found was that they were developing some pain down in this area right here. And the main thing is we need to talk about anatomy for a second. I'm trying to find a way so you guys can see it. So right here we've got the patella, which is the kneecap. The kneecap is a bone that floats inside a tendon or a ligament. Remember, ligament connects bone to bone, tendon connects bone to muscle. So the patella is really what we refer to as a sesamoid bone that's floating inside this string of connective tissue. It floats over and back, kind of protecting the front of the knee and creating a better leverage point so that when you kick your leg straight into extension, that patella actually helps the leverage, almost like a teeter-totter, if you remember that as a kid, so that we get more leverage to improve the strength and the function of the quadricep muscle, etc. The problem comes in, so you had the knee replacement, they replaced the joint surfaces, they removed the arthritis, but where that patella tendon comes down and attaches onto the front of the tibia, the shin bone, that was not replaced. That was not involved in the replacement. And so this patella tendon, you can see the bump. As a child, I had what's called Osgood slaughter, but you can see the bump on my bone from where that patellar tendon comes in and attaches. That bump develops because of the way that patellar tendon is pulling on the bone. Over decades of my life, it's created that bump. That bump is kind of like a callus, but it's bone, not skin. And so what happens is after a knee replacement now, we have a new structure to the knee. We have new forces that are pulling on the knee. And when you're walking downstairs, your knee will translate forward over your toe. It puts what we call a lot of shear force, which is kind of a sliding, gliding force through the knee, which is hard for your tendons to manage. So if you have any pain down in this area right here, where that patellar tendon would come down and attach, and sometimes you can even use your fingers to palpate and push there, and if you find a spot of sensitivity, it absolutely could be a patellar tendon issue, or where the patellar tendon attaches to the bone, which is the original bone, not the replacement, that where that patellar tendon attaches to the bone, it's a sensitive area. Talk to your physical therapist about it. It is a frustrating condition to treat, but it absolutely can be treated. In therapy, we would use isometric exercises, we would use eccentric exercises. You probably don't necessarily know exactly what those are, but it's a specific kind of loading, a specific kind of exercise, not intended for the knee replacement, but intended to heal the tissue of the patellar tendon or the attachment. But what's important is your therapist should be able to identify, is it the patellar tendon attachment, or is it sometimes where the implant is sitting on top of the tibia? Because I do find that some patients will develop severe sensitivity either on the inside or the outside, not where the tendon attaches, but I tend to think that it's a new stress area that the bone is adapting to that's associated with the way the plate sits on top of the end of the tibia, because when they do the replacement, they cut off the end of the bone, they put the plate on, they fit everything, but there could still be some sensitive spots in there. So you probably will get a diagnosis of some sort of patellar tendon issue. But we want to rule out, could it be the bone? In either case, the rehab program is going to be pretty similar. It's a combination of stressing the area to the point of discomfort but not pain, building tolerance in the tissue, desensitizing the area so that's not as painful as it used to be, and with time, that discomfort and soreness will go away. The fact that you can go upstairs without that kind of pain and not downstairs suggests to me that it is a mechanical difference. When my knee goes over my toe going downstairs, I get the pain. When my knee stays behind my toe going upstairs, I don't get the pain. So if we can control where the knee is relative to the toe, modified lunges do a great job with that. Different kinds of what we call closed chain knee extension will do a great job with that. You absolutely can have that issue addressed and it will get better. But it would be easier for you to find a therapist locally who can help identify the problem, develop a program that will rehab it to your satisfaction and get you back to doing the things you love. Guys, I really enjoy when you share the questions and comments with me. I know that I'm getting behind. I'm trying to get to as many of the comments and questions as I can, but I will do my best. In the meantime, I'll catch you on the next video.